Hey everyone, today I'm going to do a masterclass on pelvic floor health and its role and function in pregnancy, postpartum, and beyond. So the goals for today is to learn what the pelvic floor muscles are, where they are, what do the pelvic floor muscles do, and just any signs and symptoms that may indicate that you have pelvic floor muscle dysfunction. We'll also talk about the role of the pelvic floor during pregnancy, postpartum, and menopause. So, really, everyone has a pelvic floor, and this can apply to anyone, whether you are a teenager, an adult, or even someone postmenopausal. So, I just want to let you know there are some graphics ahead, so just be aware of that. So, just to give you a heads up. So, where is your pelvic floor? So, like I said before, everyone has a pelvic floor, and your pelvic floor muscles are located at the base of your pelvis. So, they attach in the front at your pubic bone, all the way to the back, your tailbone, and then side to side between your two sits bones. So, if you're sitting down right now, those two bones that you're sitting on are called your ischial tuberosities, and they're also known as your sits bones, and it's a common term that they use in yoga. So this is another photo showing a side view of the pelvic floor. So you can see that you have the pubic bone in the front, again, pelvic floor wrapping all the way to the back and the tailbone. And you can see that the pelvic floor muscles have different layers. So we have the first layer here. We have the second layer and third layers, which kind of wrap around the canal of the urethra, vagina, and rectum. And we have the third layer, which is spanning right here. So you can see that the pelvic floor muscles really form like a hammock, and they really support all these different types of sphincters. So one of the first functions of the pelvic floor is that it aids in sphincteric function. So again, it surrounds the urethra, the vagina, and the rectum/the anus. And it's important because they contract and relax like any other muscle in order to allow poop and pee to eliminate, but also to maintain continence so that you're not just leaking all the time. It's also really important for sexual intercourse, and the muscles contract and relax to allow for orgasm and arousal. It's also really important for supporting vital pelvic organs. So you could think, again, like your pelvic floor is a hammock, and it supports your pelvic organs like your bladder, your colon, your rectum, vagina, cervix, and your uterus. And lastly, it helps with stabilization. So your pelvic floor muscles work with your hip, your back, and your diaphragm muscles to maintain stability of your hip and trunk so that you can move and exercise and do any type of activity that you want, whether it be running, walking, squatting, jumping, etc. So your pelvic floor muscles play a role in the functioning of your bladder, like I mentioned. So I did want to show a little example. So in this video, the first video, the bladder is filling with urine. So the pelvic floor muscles here must tighten to allow the bladder to fill and to make sure that pee doesn't keep coming out of the exit. In this situation, the bladder muscle is contracting, and as a result, the pelvic floor muscles here have to relax. So bladder is contracting, pelvic floor muscles at the bottom relax to allow the urine to exit. So again, bladder is contracting, pelvic floor is relaxing at the bottom. So some very common pelvic floor issues that I wanted to talk about that are under 3 different categories. These are just signs and symptoms that may indicate that you have pelvic floor muscle dysfunction. So we have bladder health, bowel health, and sexual health. So some common signs and symptoms that may indicate that your pelvic floor muscles are affecting your bladder health include urinary leakage, urinary frequency and urgency. So having to urinate very frequently, as in, every 30 minutes to an hour, or having urinary urgency. So having a very strong urge to urinate and possibly not being able to hold that on the way to the bathroom. Another one is like a key in the door. So let's say you get home and you're trying to open the door with your key, and you have a sudden urge to urinate. That's also another sign of urinary urgency. Another one is garage door syndrome. So let's say you open the garage and you have a sudden urge to urinate. Nocturia is another one, so that's nighttime voiding. If you're having to urinate more than 1 to 2 times a night, or anything that's not considered normal for you, that could be considered nocturia. Having incomplete emptying of your bladder, difficulty starting a urine stream, splitting of your urine stream. So if your urine stream is kind of splitting into two different directions, having a feeling that your bladder is falling out, which is also known as a cystocele, or having painful urination. So any of those could indicate that, basically indicate that your bladder health is not considered normal and could indicate that the pelvic floor muscles might be playing a role in these signs and symptoms. And then we also have bowel health. So if you're having constipation, fecal leakage, fecal urgency, straining to poop, diarrhea, frequent wiping. Frequent wiping is a really good one to consider because that basically means that maybe the anal sphincter isn't closing all the way. So there's this passive seepage of stool still eliminating from the anal sphincters. Having nausea and bloating, which are also really common symptoms of irritable bowel syndrome, are signs of pelvic floor dysfunction, as well as feeling like your rectum is falling out or having painful pooping. Again, painful pooping, it could be because your pelvic floor muscles, again, which are at the base of your anus and your rectum, those muscles may be really tight and may not allow the poop to smoothly exit. So your poop may be trying to exit through a very resistant sphincter, which could be painful. And then sexual health. So pain with any type of penetration, whether it's tampons, intercourse, pap smears, or even pelvic ultrasounds. Your pelvic floor muscles have to be able to relax to allow for these activities to happen. And if those muscles aren't relaxing, again, it could be because it's tight. It could be because your hips aren't in good alignment. It could be so many different factors that could be causing those muscles to not fully lengthen, causing discomfort with these activities. So we kind of talked a little bit about what the pelvic floor is, where the pelvic floor is, and what functions the pelvic floor does. Then we also talked about different signs and symptoms of pelvic floor dysfunction. So we talked about bladder health, bowel health, and sexual health. Now we'll kind of go into the pelvic floor and its relationship to different kind of stages or scenarios, such as pregnancy and birth. So this is a photo of the base of the pelvis. So we can see the pubic bone here. We have our two buttock muscles here. This is the baby's head. And the muscles in red, these are your pelvic floor muscles. So we have our anus right here, our tailbone here. We have our glute max muscles, and then these muscles are the levator ani muscles. So did you know that your pelvic floor muscles are really working 24/7 to support the growing uterus? So again, the pelvic floor is like the base, and as that baby grows, as the uterus grows to support that baby, those pelvic floor muscles have to work pretty hard to support that body weight. The pelvic floor is also really important for just stability of the pelvis and to maintain continence and everything like that. During birth, you should think about the pelvic floor muscles as the exit point. If that exit point, if that door is really tight and closed shut, the baby's going to have a lot of difficulty exiting out the vaginal canal through the pelvic floor. So if you think about this opening here, if these muscles are super, super rigid, the baby's going to have to, or you know, push a little harder. You may actually have to push a little harder to get the baby out. So you really want to think about the pelvic floor being relaxed, pliable, almost like a trampoline. So it should have some mobility to it, some elasticity. It shouldn't be rigid and tight and immobile. And there are things that you can do with a pelvic floor therapist to learn how to connect to your pelvic floor, to relax your pelvic floor muscles, to facilitate this process so that the muscles can relax to allow the baby to smoothly exit the pelvis. Another interesting fact is that the pelvic floor muscles can actually stretch up to 250% to accommodate the baby's head. And really the main focus of your third trimester, if you're interested in seeing a pelvic floor therapist, is to optimize the pelvic floor length. So think stretching to decrease the severity of tears or the risk of having a tear, to decrease the risk of using assisted delivery techniques such as a forceps or vacuum delivery. Also, the more length and more pliable your pelvic floor is, you don't have to push as hard because the space or the environment that the baby's in is nice and soft for it to enter and exit the pelvis. And again, it just allows for a smoother delivery. The pelvic floor during the postpartum period. So if you did have a tear, usually the tear happens in the pelvic floor muscles. So there are different degrees of tearing. So we have first degree, which is the most, I guess, least severe, and it's a very superficial tear. Second degree tear involves some tearing of the pelvic floor muscles. Third and fourth degree tears involve tears through or into the anal sphincter muscles, which that happens, that can contribute to symptoms like having a tight anus or fecal leakage and things like that. So if you think about it, again, these muscles are like muscles like your hamstrings, your quads. If you tear these muscles, it can affect the function of your pelvic floor. And again, your pelvic floor plays a role in sphincteric function. It plays a role in stability of your pelvis. It plays a role in supporting your pelvic organs. So if these muscles are torn, it's not going to function as well. So if you think about it like, if you strain or tear a hamstring, you're not going to be able to run or walk or even stand very well because it might be really painful. Same thing as the pelvic floor. If those muscles are even slightly torn, it can affect the function of your pelvis and its ability to perform sometimes simple activities because maybe other muscles might be compensating, like your back, because your pelvic floor is not working as well, and then you might be getting like back pain. So it's really important that if you did have a tear, a episiotomy, a pelvic floor tear, to seek a pelvic floor physical therapist just to help heal and recover that so it doesn't lead to future issues down the line. So again, just some very recap of some common pelvic floor issues that you might be having. It's always good to get it checked out by a pelvic floor therapist. And again, you don't have to be pregnant or postpartum to have pelvic floor issues. So you can have these symptoms even as a teen. You can have these symptoms as an adult and never been pregnant. So consider that as well. The pelvic floor also changes during the perimenopause and menopause years. So now we're kind of moving away from pregnancy and postpartum into perimenopause and menopausal ages, which is around late 30s to 40s, and then menopause is around 50 years old. So around 35 years old, your estrogen levels start to decline. And your pelvic floor muscles and connective tissue in your pelvis contains a lot of estrogen receptors. So because of this drop in estrogen, we can notice some changes in your pelvic floor, and thus you may have pelvic floor muscle dysfunction. And that's where you may have changes in your bladder health, your bowel health, or even your sexual health. So what happens? So with estrogen, the vaginal lining is very thick. It's very luscious. It has a lot of fold. And that's very important because it allows the vaginal opening to be able to stretch and to have intercourse in childbirth. But as you get older, with the lack of estrogen or lower amounts of estrogen, the vaginal lining is a lot thinner, there's fewer folds, it's less flexible, and that can result in symptoms like urinary leakage or even like painful intercourse or having pap smears or even pelvic ultrasounds, which I commonly see. So some very common menopausal related issues I see are urinary and fecal leakage. And this can be with sneezing, coughing, laughing, jumping, bending, walking. Oftentimes I see a lot of nocturia, so having frequent nighttime voiding. Going about 0 to 1 time a night is typically normal. But if you're having to go as much as 2, 3, 4, as much as 7 times a night, you should get that checked out. Constipation is also really common because the colon motility slows down as you get older. So colon motility is the movement of stool through your rectum. So you may be more constipated. You may have infrequent bowel movement, harder stools because the stool is staying in the colon a lot longer, or even having to strain or push to defecate the poop. Pelvic organ prolapse is also a lot more common, feeling like something's falling out. And it possibly could be because the pelvic floor muscles and vaginal lining lack that plumpness or that support to support the pelvic organs. And then pain with penetration, so intercourse, pelvic exams, And it could be due, again, with the drop in estrogen. So that can lead to vaginal dryness, decreased size of the vaginal opening, and just loss of elasticity of the vaginal tissues. So I think some good takeaways to know is that, everyone has a pelvic floor, and it's important to recognize if you feel like something has changed with your bladder, your bowel, or your sexual health. So if that something feels off or doesn't feel like normal, talk about it, whether you bring it up to your doctor, see a pelvic floor physical therapist. And in California, you can see a PT without a referral, which is awesome. Talk to a friend or other moms, because I'm sure other moms or maybe your girlfriends maybe experiencing some of these symptoms as well. So um, I guess don't be afraid to talk about it, because it's these signs and symptoms are very common, and very likely you're not the only one experiencing it. A pelvic floor needs can be a sensitive and intimate topic. So if you're not comfortable yet, it's okay. Just talk to someone you trust that you feel comfortable with, just so that you can get it taken care of. It's just really sad sometimes to see my patients live with these signs and symptoms for 20 or 30 years when they could have gotten help very early on and didn't have to have any of these symptoms. I also think it's really important to build awareness and talk about this more often. That way we kind of, normalize these conversations, and it decreases the delay of seeking evaluation and treatment for our pelvic floor muscle dysfunction. So if you enjoyed this masterclass, if you learned something about your pelvic floor, super excited for you. Be sure to follow me. You can follow me on my Instagram, check out my website. If you'd like to book an appointment with me, if you're in California, I'm in the Bay Area, to just learn more about your pelvic floor and your pelvic health, or if you're having changes in your bladder, bowel, or sexual health, feel free to reach out. You can contact me via email.